If you're anything like me, like learning anatomy through sports injuries, this episode 67. Whoa, he said the numbers. He's saying, hey, we gotta go.
Oh, no,
it's happening.
oh, no,
It's happening.
oh, no,
It's happening.
oh, no.
Activate nerve roots 5 and 6. 5 and 6, quick. I'm on 5 and 6. I'm on 5 and 6. Roots 6, 7, 8. 6, 7, 8. Go. I'm on 6, 7, 8. I'm on 6, 7, 8. Buys and tries. Hurry up. Triceps firing. Triceps. Perfect. Look, he's doing it. 6, 7. Anderson Silva, December 28th, 2013. Anderson is in the yellow shorts. Blink and you might have missed it. We have other angles, of course. This is Chris Weidman. Second time Chris has been on this show. So Anderson is going to try and kick Chris. It's going to get checked, and Anderson's leg has an extra bend in it. You're really only supposed to have 2 bends in your leg, your knee and your ankle. That's a third, okay? That's not good if you are Anderson Silva. So what happened? It was a tibia-fibula fracture. It was a closed fracture. We'll talk about that in just a second because it's kind of gross. So he kicked near Chris's knee, right? The shin made contact with the distal femur, and what happened was Chris's distal femur accepted the force of the kick, and Silva's shin was overwhelmed by the force, and that's what caused it to basically snap. So you can see here, he kind of kicks just below the knee, so you would think that it's kind of like at the top of the tibia, but I really think it's like at the distal end of the femur, kicking into his hip almost, so all the force goes through the femur up into his hip, rather than through the top of the tibia. And in that case, you might think like PCL injury for Chris, but that did not happen here, obviously, because Anderson Silva's leg snapped in half. So what did they do? Stabilization in the ring. The ringside doctor actually placed his thumb on the fracture site to prevent it from puncturing the skin. As gross as that sounds, you don't want the bone to poke through because that could raise the risk of infection and also cause more damage than there already is. So he had surgery. They placed a rod in the tibia, used screws to secure the fibula to the tibia. He did physical therapy. Break it down, obviously, but progressive loading and strengthening is what you normally do for injuries like this. He did return 13 months later to fight. He won via unanimous decision. However, this was overturned afterwards because he was using steroids. He was using androsterone and drostanolone. This was actually overturned due to steroids used to increase strength and reduce body fat, often used in like cutting cycles. It's also used in breast cancer treatments. Nonetheless, that is Anderson Silva.